Thank you, Conrad. Thank you all for being here today. I know that if you've listened to any of the members or any of the testimony, the advanced appropriation was a huge step forward, but it was only a step forward. We would all like to, I think, get mandatory funding for Indian Health Service. I said this morning that I think it's the only health service program in the federal government that isn't mandatory funding. Mm-hmm. And Tom Cole was sitting here and he said, and it was the first one. And it's the only one that's not mandatory funding. So we're still working on that, trying to figure out exactly, because first question I ask is, so how do you make it mandatory? And it's not a simple process, but it's something that we got to continue to work on and get it. But obviously last year during the shutdown, it was obvious how important that advanced appropriation was. And again, I'll tell you, I think you were the chairman, weren't you, Shelley, when we did that? Yeah. And so a lot of credit goes to her. A lot of people worked on it, but she was the chairman at the time, so she deserves a lot of credit for pushing that and stuff. But thank you for all you do, and thank you for your testimony today. And Abigail, I just wish you could get a little passion for these issues, you know?
I try.
You do a great job. Thank you.
Thank you.
Yeah, thank you. Thank you all for being here. You do some of the most important work in Indian country, and thank you for that. And you are a brilliant storyteller, but I'm sorry about the stories you have to tell. Really, it's just so sad to hear them, and appreciate the dedication that you have and the work that you do there in Seattle, and really to all of you in the organizations that you lead and that you work with. Just so critically important. I, too, would like to see us get to mandatory funding, and I think it's just a travesty that we are so underfunding Indian health, and particularly when we have other government-funded health programs that do better than this. So it just is it's a bad reflection of our priorities, and we should reverse that as soon as we possibly can. And you brought up so many things that we've been talking about already today, but just, really getting the adequate funding there. Conrad, you mentioned Medicaid, and I'm worried about the cuts coming to Medicaid and how that will impact Indian country, because I know we not only are underfunding Indian health, but we depend on Medicaid supplementing the system, and I just don't know how that will impact things going forward. So I think we have to put whatever protections we can into the language of this appropriations bill about how we hold that harmless and make sure that CMS understands that this is Indian health funding. It just can't be a part of the regular Medicaid cut. One thing that, Francis, you mentioned when you said that cancer was the new diabetes, that's deeply disturbing. I know how devastating diabetes has been to Indian country, so just give me a little bit of sense of, are there certain kinds of cancers that you're all seeing more of, or that you're referring to? We know there's a rise in cancer, but just that's really worrisome.
Yeah, so I can get information from you from Robyn from the Oklahoma City Indian Clinic, but I know that it's been significant, and there's been a lot of different issues there, and I don't know, Abigail, if you had any data on that.
Yeah, so when we look at the epidemiology of what's going on around cancer, some of it, the ones that Native people die the most of are the ones that are the most preventable. Colorectal cancer is one of the ones. I was working on a project one time where we were trying to get an education program out for people to understand what it means to get your colonoscopy, what age you do that at. But what we found is that while we could get people like a basic, like a test prior to understanding if they needed a colonoscopy, there was no funds in the tribe, nor did the Indian Health Service. It was one of the least priorities in regards to when they get to the bottom of their dollars, who gets the colonoscopy. And so despite us getting people interested in being screened, they still wouldn't have gotten a colonoscopy anyways, which is why Native people are more likely to die of colorectal cancer when it is the number one preventable cancer. We've seen the rise of other cancers, and we can see a lot of work going on, research right now, tying it to environmental factors, particularly reservations close to nuclear plants, for example, or where there is a lot of water pollution. And so we see the impact of these extractive mines and other things that have left behind a legacy of toxins that are directly impacting. And so we're seeing this rise whether or not you're in an urban setting or whether or not you're on the reservations.
Yeah, that's deeply disturbing. Well, I hope we can spend a little more time and money following that and also get the preventative care there. But one of those things is if there's not enough healthcare dollars, preventative care is often the thing that goes first. So that's a big challenge. Well, again, I really appreciate you all being here today, and thank you for your work.
And I would just say, the work that Robyn does in Oklahoma City and others is there's so many stories of success in Indian country. The screenings, during COVID-19, we had the highest vaccination rates. We see that even though we see diabetes increasing, we have seen more results in any other racial or ethnic group in the country in getting more of a flatline prevalence, not seeing it as shooting up as high as some other populations, even though it's still very, very bad. And I think that we need more opportunities to tell the strengths of Indian country. For example, around missing and murdered Indigenous women and girls, this was something that developed after the hearing that thank you so much for allowing me to testify in that hearing on missing and murdered Indigenous women, girls, and people. I look towards what happened in Chicago, where the bones of an individual were found, and a cold case detective had begun to see all this stuff in the media and and understanding. I think our hearing probably had something to do with it too, as to where he dedicated his time. And a woman that had been missing since the early 1960s from the Acoma Nation in Washington, she was found. Her bones were returned, and it was only because of the dedication of that police department, non-Native, but who were beginning to see what's happening across the country. We see the implementation of Savannah's Act, the Not Invisible Act. We know that when done appropriately, these pieces of federal legislation can work, and we have success stories. But it requires success stories and continued oversight to ensure that we see the success that Indian country deserves. It's our treaty and trust. That's what we're pushing for.
Thank you.
Chairman, if I can add on just
Sure.
real quick. We talk about cancer and where it's coming from. I can honestly tell you, White Mesa Mill, energy fields, that uranium waste facility has already contaminated one aquifer and going down to another aquifer. And you can tell from the people in that community and the surrounding community that they're being affected. So it's coming here. It's coming here with all the studies. So I'd just like to put that out there. Chairman.
Thank you. Thank you all for what you do, and thanks for being here today. Appreciate it very much.
Thank you, Chairman.
Teresa Sanchez, Esther Lacoro, Aaron Hines, and Lendra Ross. Is that right?
I'm Leandra. Yeah.
Leandra, okay. As you can tell, I'm not really good at pronouncing names other than like Tom or Mike.
That's okay.
Yeah.
Oh, I'm sorry. Take this.
Yes, you can't come up here, Hester, without a sign. No, I'm just kidding. Teresa, you're first.